is cleft palate a condition that can be avoided?
Okay, I think I can answer that. So,
Yes.
the current thinking right now, and the evidence points out that clefting is genetic, and at the same time influenced by environment, specifically nutrition. Okay. So, Operation Smile, that not only just cut and sews, no? We're also involved in research. We have for a lot of foreign help. They gather data also, of course, with the consent of the patient, and then process it. And then right now, we are working on a program because they have identified that a certain B complex vitamin is lacking during the organ formation period of pregnancy, okay? Which is about 5 to 6 weeks. The mother doesn't even know that they're pregnant. So if they don't have the right nutrition, and they have the genes, then the cleft would manifest. Okay? If you have the genes, but you have properly nourished, the cleft might not be that severe, or it might not even come. So prevention is, of course, you don't tell the patient, so you have a cleft, your child will have cleft. But we try to educate them in terms of what the right food to eat. At first, you'd be amazed. Here in the Philippines, when I was starting to do this, the mothers were very, very guilty because they thought that it was something they did or did not do during pregnancy. And the husband would usually leave the wife because they're responsible. In fact, the genes might have come from the husband. So we started educating. It's not your fault. Okay? This can be treated, and these are the things you need to do in order to minimize or prevent.
Kasi, well, when we were when I did stories about Operation Smile before, I did realize it was the whole process. So I think what we have to highlight now is it's not only the surgery, as you said, it's the entire comprehensive part, and it's a multidisciplinary approach
Yes.
to this problem. So just for my curiosity, how much does a cleft palate surgery cost?
Okay.
Just the surgery itself.
The surgery itself, but before, we don't really just sell, I mean, when we say surgery, for us is a package, comprehensive cleft care. We don't say, oh, just the surgery. No. So when we go out to public, we say a surgery, automatic there is, or the consultation, or the follow-up, or the comprehensive care. Now because of COVID, the price per one patient is at 30,000. Before COVID, we would sell, I mean, the price will be around 20,000. COVID alone, I'll explain you why. For our medical standard that we follow, every patient and companion will have to do RT-PCR, non-negotiable. And so, with that said, so if you can compute how much is an RT-PCR, plus the PPE, the mask, so that's the why the increase of the 10,000.
Thank you.
You're welcome.
Maybe later on.
After Sir Donald, will MaxiCare cover cleft care package? Will there be a time? Yes.
Sure. As of now, no private health insurance are covered in general anomalies, especially, but the government does. There's been a very significant increase in what the government can actually gives the surgeons and the doctors. Now, the cost does not, of course, involve the professional fees because we do not charge it. This is our voluntary.
Just the admin.
Just to give you an idea, if I do it in Makati Medical, I would charge 100,000 professional fee. Because it's not difficult now.
Because it's plastic surgery.
You're right, but for cleft lip, I have a very soft heart. It's for that. Even if the patients can pay, I don't charge because we're used to doing this for free.
Thank you po.
And to add to that, when we say the 30,000, you have to consider it including transportation, meal, everything.
Yeah.
So it's a package talaga per patient. Kasi some patients may come from Manila, so if it's our center Manila, it's easy for them to travel. But we get patients sometimes from Quezon province. So of course, we reimburse their travel expenses. Kawawa. So
Alright. Any more questions from the floor? Sige, habang nag-iisip pa, I'd like to lead the discussion naman to the needed private sector support. Sir Donald, you've talked about this, the need for more private sector support, no, for this issue, the resolution of this issue. And with J&J here, ano yung kailangan pa po natin siguro from the private sector or even the government for this issue?
Well, for the private kasi sabi ko, especially during the pandemic, the private sector medyo nag-contract di ba? They're less optimistic muna, the uncertainty, business, lahat points towards a recession. Di ba? Pero ang nangyayari, the reality is the cleft children, hindi naman nawawala, ganun mas dumadami. So I think that's one of the biggest challenges. How do we put that in front of the agenda, right, of private institutions? Currently in the board, kami rin, of course on our side, sabi ko, we've been here for more than 10 years. We really donate our time. So, when I was inviting a lot of our friends in the MEB, in the business segment, so we have Lisa Mandari with us, Sanjay Bora. So these are really leaders in their field. No? Sabi ko, I have nothing to pay you except coffee. But they give their expertise, their network, and everything, no, to really help us, no, as we drive. Kaya sabi ko, we're very proud of our doctors. Kasi sila, di naman nila kailangan gawin to pero ginagawa nila, no? And that's why on our side, we try to help them in of course, the management side of it, the fundraising, partnering with J&J, kung ano pang kaya, no? Kasi nga, it's not, hindi kasi siya red alert, hindi siya ganun ka priority. How do we make it a priority agenda is always our biggest challenge. Diba? Kasi pag pinag-usapan siya pa, okay, it's important. Pero hindi naman urgent yan, hindi naman life-threatening, hindi naman, diba, daming if, diba, or daming sinasabi, no, and that's why I think, even before, we've grown as an organization. Before, di naman namin pinag-usapan comprehensive as clearly as we have now, very focused. Hindi numbers game, hindi yung padamihan ng operahan, hindi kami ganun. We're very proud of the fact that it's comprehensive and all the way from like what I've said, start to finish, hanggang okay ka na. Hindi yung operahan. So that's why on the business sector side, dami ng problema sa mundo Diba? Parang what operations smile, left flip palate, sige na, kaya ako na. Diba? So I think that's why we kept on pushing that. It's very important. It's very important, and I think in terms of especially right now for a lot of foundations, we're very lucky. A lot of foundations are also helping us in many ways. So, and we just want to keep pushing kasi this is important. Like what I've said, when I started, mabilis sabihin you change the life, no? But when you're there, like what pinakwento ni Ibig, kung na-experience nyo, even before kami, many years ago, pag binigay ng nanay ang baby nila sa iyo at umiiyak, at pagbalik mo sa kanya ayos na at umiiyak at nag-thank you, iba yung feeling mo. At alam mo talaga, yung buhay mo magbabago. Right? So it's all about that. No? And again, you can never do that with any other foundation. Save the earth, of course, all of that's important. Pero ito, kita mo talaga na itong buhay na to, binago mo, no? because of simple operation.
Alright, thanks Sir Donald. Kung volunteer din po kayo dahil na-inspire kayo sa mga nagkukwento na, magsabi lang po kayo. No? But yes, we're talking about Emil.
Yeah, a lot too. You said about volunteer. I mean, from corporate, it can be time, money, knowledge, anything. Even volunteer, kung hindi, kasi there is also this misconception na kung hindi medical practitioner, hindi ka pwede ma-volunteer. It's not true. We have medical records, for example. This is a non-medical. We have a PIT, or those who takes picture of patients. Those are not medical. Or volunteers in general, because when we go in a location, imagine sometimes 200 patients show up. So you need manpower to help. So in any way possible that corporate or private can help us, we accept.
Thanks, Emil. Alright. Miggy, we're talking about volunteerism, and sa J&J may mga volunteers din apart from your program na diniscuss kanina. Could you tell us more about this, and in line with Donald's theme kanina of pushing the envelope, what can we expect more from J&J?
So, to be honest, when I first joined J&J, my first week was the speech camp of Oxfam. So like what he said, parang iba talaga yung pakiramdam when you're there and you're interacting with the kids. So you think, oh, what are you doing there naman? I'm just a regular employee. I'm not even a pathologist or a surgeon. But in fact, they do need a lot of manpower. I remember the first session was about 20 kids on skip ng room. How do you manage all of them? And as volunteers, you're there to really cue the crowd, right? So obviously, this was before the whole pandemic. So that was so much, I feel, more convenient. Now it's a little bit more challenging because we have that element of COVID, right? But right now, we've been doing, I think, the first wave of teletherapy. We've really mobilized most of our employees to educate. So when I said it's complete cleft care, right? It's not just surgeries, but what after. So what our employees did, we got the brand managers from Listerine, which is me, and then Johnson's, and even Doctor, and all of these things. So we were there informing the mothers, kasi in the therapy sessions, it's child plus mother. We're saying, oh, mommy, ano ba yung importante sa mga bata? So, her giving her basic oral care regimens, how to practice proper hygiene. So there's this element that even with our expertise, we can educate the parents. So that is ongoing, tuloy-tuloy. And I guess the next phase is the awareness phase. So I think that's the most important because, again, I keep stating the statistic, 5 million untreated cleft cases, diba? That's quite large. So how can we as a company with like media budgets and you guys as PR institutions with the reach that you have, bring out awareness, and that's what we're doing. So we have a lot of programs with our employees, advocacy programs, and even with our brands, specifically with Listerine, that's something that we'll push forward until the end of the year. So abangan our barangay initiatives within the next few months, and yeah. So
Thanks, Miggy, for that.
Alam mo, we kept pushing awareness. It's already be 40 years din. 44 years lahat wala. Operations file. Kahit ang paikot-ikot namin, alam mo bukas. Next year, pag sinabi ko operation, oo nga, parang ganito, parang ganun lang. Diba? So kailangan talaga namin ng yung talagang push and not only awareness of the brand, it's not about that, but really to really care about the mahirap eh, kasi we're all volunteers eh. We can only do so much also. No, we kept pushing the envelope and it's just us. No? And while we get people come in and out. Pero again, sabi ko, hindi siya agenda, hindi siya important or hindi siya priority.
Thank you, Sir Donald. Any more questions from the floor? Miss Ann?
What other areas are you targeting? Di ba you already have centers in Manila, Pampanga, and Davao. What other areas are you targeting here in the Philippines?
Yeah, so those are our three main areas. Now we're working on a project in Cebu. Yeah, this will be one of our largest centers in Cebu. This is in, of course, aligned with our 40th anniversary. Cebu Center will be slightly bigger than any other because we will have a training component opportunity where, while all our center has a training component, the goal of Cebu is to make it a training regional hub as well. So to get doctor from not just Philippines but outside the Philippines to come in the Philippines and be trained by our expert plastic surgeon, anesthesiologist, pediatrics, and the likes. So that's Cebu. And then the other, we are working more on spokes. Bacolod is one spoke that we're looking at right now. Palawan as well is another spokes that we're looking at right now. And Naga as well, it's another location. So those. So in 5 years, in a 5-year span, because we are looking to have about 4 hub and additional 6 spokes. So that's the goal. So kinda really do the big jump. So we're trying to get this momentum of the 40th to really push it and create awareness, get the support so that we can expand faster.
Thank you.
You're welcome.
Alright. Last few questions. Axel and then Julia.
Hello. I asked ko lang how long training na mga volunteers for the surgery? The training, the volunteers.
Okay. Traditionally, it's a plastic surgeon who does plastic surgery. Okay, but again, I'm so ashamed that my society there are only about 20% of us who do missions. The rest would rather enrich themselves. No? So we're trying to teach the younger ones. Please, there are kids there. Now they keep on trying to fool themselves that there are no patients there. Like for example, in summer there's no plastic surgery there. So to address this problem is that aside from trying to invite them all the time to join the missions, okay, we also are training, inviting other specialists, you know, who can do cleft. Okay, who are this? These are ENT. These are pediatric surgeons. Okay, the only thing we need is that okay, they volunteer. At the same time, they work within the standards of what we consider safe, the global standards of safety. So we, in our mission site in Pampanga, I'm so proud to be able to tell that we were successful in having 2 ENT surgeons, young ones, okay, joining us. And they were so happy that now, of course, without telling you, there are fights between organizations. Oh, we're supposed to be the one doing this. You're not supposed to do that. So we want to break those barriers through Operation Smile, because like as you notice, people, volunteers come from different areas of life, yet they come together to produce a child that's a smiling child. So we can do this also with other specialists. So that is my personal goal. That I would like to see that happen during my lifetime. Okay. Now, for volunteerism, why don't you make it your personal, specific advocacy to recruit patients? You have the tools, you have the means. Okay. One of our very very successful supporters in San Salvador was the father of a patient. He was so impressed. So he started by disseminating in his neighborhood, stories about Operation Smile, because he wanted to share what he experienced with his child. And he on his own, a dilapidated truck, went there and recruited patients. So you don't need to go there. Media can reach everywhere. Okay, so that could be one thing you can do to help us a lot.
Thanks, Doc. So JM, you have a question?
You mentioned, Emil mentioned earlier about the partnerships, like with AirAsia, you have transportation, and then with PNP Region 3, you have recruitment efforts. Kasi you were mentioning earlier about the need for more partnerships, but what specific areas of that comprehensive program needs specific partnerships? Kasi we all know we have the private sector, the government, but they don't know any specific help you need.
Okay.
What key areas do you need?
Okay, so very few people actually realize that you disseminate, okay, we're going to have a mission in this site through radio, social media, and the stuff. But very few people realize that these people know that there's a mission. They cannot go to the site because they don't have the money for transport. That's how poor most of the Filipinos are. So it's very, very timely and very, very helpful that Philippine National Police in Region 3 would get the patients. We identify the patients for them, okay? And then they get the patients from the barangay and then bring them to our center and then they bring them home. And the PNP likes that because it's aligned with their barangay Nihan projects. Before, I can still remember the head of PR03 told us, okay, every time a police car goes there, they thought that we're going to arrest somebody. Now, we have a better image because it means we're going to help one child smile again.
So that's one. That's transportation. Are there any other?
So there is a lot of components. So when you look at comprehensive cleft here, right, it could be supplies, definitely medical supplies could be on the nutrition component, could be anything around nutrition. We have also some partners that really support us on the nutrition. It could be medical equipment, because remember, one of our goals is really to go into district hospital and try to help them revamp their medical equipment, try to help them. That could be Of course, support monetary, right? I mean, at the end of the day, we have expenses for the children, that 30,000 which goes into the children. So we need to have that so that we can buy again all this supply. So we have different category where you can donate in kind, number one. You can donate monetary, number two. You can donate in time. Even strategize. Meaning, if you are a good corporation that wants to come with us, sit on a table, want to help us to strategize, we will welcome those, because that will help. Like, we do a lot with Johnson & Johnson. When we look at the project, we don't just a matter of, we come up with a project, we implement. No. We really spend time together to really plan it out, understand it. So, it's really a place variety that businesses can help us go through.
How about government? Sorry.
Okay, with government, my biggest dream, and we're trying to build it now with Johnson & Johnson in Manila, is starting in Manila City, is every barangay is aware about cleft lip and tongue and knows how to, number one, identify cleft. Second, knows how to refer anywhere. And the idea is also every barangay will hopefully get some budget allocated to be able to air transport the patient to our facility. Right? Now, imagine if you just solve that one problem, how many patient now gets aware, know where to go, know where to get assistance, and receive care. You already cut down out from that 5 million untreated, you already cut down 5% by just getting that support from them. In Manila with Johnson & Johnson, we're starting a project, soon be launched. It's really to empower barangay on awareness. Because that's our specialty, right? But if the government, the LGUs, or can really support us on that, just create awareness and really empowering their own people to recruit and to bring, that's going to be a huge help for us.
Because it's really the reach, right? I just wanted to just cite an example. So for J&J, we actually partnered with Watson's. So you're aware that it's a pharmacy, a lot of reach, people go there for their healthcare needs. So together with the barangay, actually, we'll be also seeding basic educational materials. Where can you sign up a patient? If you want to volunteer as a pathologist, a surgeon, how can you contribute or give back? So those types really expanding the footprint. So how can we do that? Definitely grassroots is really the trust for the closing quarter. But our partnership with Watson's will also help widen that reach. So how else we can contribute awareness to it is really the aim.
Sure. I was in Tondo 3 months ago. We did a project, the speech therapy, we did a project. So UPS is also one of our partner. So we deliver gadget to our patients at home so they can do live speech therapy. So I went to Tondo, really inside the community. Went in, and we went to this house. Carol, my staff, was with me. It was very small. And so I asked the family, is there any other patients around this area? And the guy goes, actually, sir, yes. And I say, why they don't come over? Sir, number one, they don't know what cleft is. Two, they don't know where to go. And third, they think it's so expensive. So imagine now, these people are part of a barangay. Right, going back to my thought on the barangay. If the barangay create programs around awareness that it's free, now these 3 families can receive care. And after that, what happened? I am the first family receive care. I become an advocate.
Yes.
I go to the next family. Operation Smile, we libre, different families. And then the next, and then the next. So I hope I answered your question.
Imagine mo, nandun na lahat ng doktor. Lahat kompleto, tapos walang pasyente. Mahirap.
Yeah.
Kawawa naman.
Sayang.
Sayang. No? Before we partnered with the KBP, kasi medyo grassroots nga eh. Di naman nasa dito yan eh. Diba yung mga may cleft lip and tongue. Nasa barangay, nasa malalayo, diba? So how do you get them? So when we partnered with KBP before, parang mga regional radio stations,
Yes,
dapat
yes.
mag-announce, o punta.
Yes.
Yung iba talagang they gather together, magbabarko pa sila, yung gano'n, no? So, I mean, yung end-to-end na yun, ang laki ng chain na yun.
Yes.
So, hindi lang siya yung, minsan inisip mo nga, opera lang, nandun yung doktor, nandun yung pasyente. But to get that entire thing going, no? And so, imagine mo yung trabaho namin, all the way from the
Yeah.
procurement also of the patient, not only on the supplies and doctors and everyone else, no? But also on the patient side.
Tapos are you still in touch with yung mga recipient ng comprehensive care? Parang meron ba kayong mga successful story na they receive the care then become part of the for 40 years na, di ba? For mga first patients na who become volunteer also of operations.
Yes. So yes, we have actually many stories like that. Some locally, some internationally. It was a good story actually. It happened a month ago. One of our top surgeons, Dr. James, Dr. Sunny Santos, it's also a plastic surgeon, flew to Morocco to an international patient. And the nurse assisting him in the OR was a patient that he operated 20, 30 years ago. And so when they said, they got so emotional because, imagine, because of that, she became a nurse. So we have many stories like that. Chadlin also is one that, we did a surgery, she became a singer. So
Siguro yung maganda i-highlight din sa mga
Yeah.
success stories.
I'm sure we can ask
They are the
Palate
best
to
team
share
for you.
those stories.